This afternoon, I would like to share, this is not a lecture, actual. Of course, it's not a lecture, but yes, I prefer to say that this is a sharing of experience. Yeah. I would like to address the palliative and spiritual care in the umbrella concept of Sharia hospital management. So I understand that some of you are the practitioners in hospital. Is that right? And maybe in other healthcare facility. Maybe you want to share with us here, what do you mean? What do you know about palliative or spiritual care? Does anyone of you want to share with us here? What do you think is palliative or spiritual care? Anyone want to share? All right, no one? Okay. All right, let's see. This is the agenda for this afternoon session, right? I want to share with you the first is the introduction, what is palliative care, and then also about the global policy, what is going on, what's happening in the worldwide about the palliative care and also spiritual care, and general concept about the palliative and spirituality, spiritual care, and an example of addressing palliative or spiritual care in Muslim country, especially in Indonesia, Yogyakarta. Yeah? So basically, if we are talking about palliative care, the terminology of palliative care, palliative itself, comes from the Latin word, which is palliare, which means to cloak. Cloak, as you can see from the right side, it's like Indonesian is jubah, yeah, jubah. So it covers. It means covering, yeah. Jadi, so palliative care means like covering yourself, covering giving a cover to the patient, yeah, which leading to an approach that improves the quality of life. Yeah. Basically, what palliative care delivers is improving the quality of life patient and also their families, yeah, who are facing problems associated with life-threatening illness or serious health-related suffering. Yeah, so this is, we are talking about the various scope of life-threatening illness, yeah, and not limited to end-life care, yeah, not limited to end-of-life care. So, what do you think? What could be the kind of illness that we are going to talking about? Ladies and gentlemen, what do you think about the cases that we are going to talk about? Life-threatening illness or serious health-related suffering or end-of-life care. What do you think? What could be the condition or illness? Yeah, of course, like cancer, right? Cancer is life-threatening illness. And then also like COPD, yeah, with which is resistant to the current treatment. AIDS, yeah, AIDS also one of them, yeah. It is not considered to be the last resort, but should be integrated early, right, in the care of people affected by a life-threatening condition. So it, you can see from here, this is a schematic description of how we can deliver the palliative care. So if the diagnosis will start here, any diagnosis for any illness, yeah, we started to give the palliative care. Yeah, this is for the life-threatening illness, yeah. So as the disease progression go on, yeah, we started to give more proportion of palliative care, yeah, because we are not postponing the death, right? Eventually, all of the people with life-threatening illness will die. Yeah, will die. But we are going to increase the quality of life. So that's why the palliative care are increasing along with the disease progression until the death come. And then we give also the palliative care to the family, yeah, as bereavement support. So this is how palliative care is delivered, yeah, currently. Okay. Ladies and gentlemen, I will ask you to ask any question along the way the presentation. If should there be any question, yeah, just raise your hands or just ask what you need. And then if somehow my voice is not too clear, just give me a shout. Okay, palliative care is needed in almost half of the deaths, yeah, around the cases around the world, yeah. And palliative care is required for patients with a wide range of limiting health problems and chronic diseases such as cardiovascular diseases, yes, almost 40%, cancer, yeah, around 1/3 of the cases, and also chronic respiratory diseases, yeah, almost 1/10, AIDS, and diabetes, yeah. Patient with any other condition may require palliative care, such as kidney failure, chronic liver disease, rheumatoid arthritis, neurological disease, dementia, congenital anomalies, and drug-resistant tuberculosis. So as you can see from here, that the various type of disease or illness is very high, is very wide, yeah. For any patient and also the family to get palliative care. Right? And then from this schematic also we can see that palliative care composing end of life care and also terminal care. Yeah, so it's a bigger scope. Yeah, which comprising people living with life-limiting illness with any prognosis. Yeah. So in here, in this scope, we are also doing an introduction to palliative approach, and with the aim of maximizing quality of life. So in here, we are doing symptom management, palliative chemotherapy or radiotherapy, palliative surgery, and also we are maximizing community supports and psychosocial support. Yeah. And if you look at the end of life care, you can see here the difference, yeah, the difference of end of life care and the terminal care, yeah. So the terminal care is discussing about the patient, yeah, the cases that need days to hours to life, yeah. Whether the end of life care, they still have weeks to months to live, yeah. But you can see that the similarity here, that all of them needs psychosocial support of patient or family, yeah. Yeah. You can see in end of life care too, that psychosocial support, also spiritual health care, symptom management, yeah, and etc. Well, current data estimated that each year there are 20 million people in need of palliative care in the last year of their life, yeah, with many more requiring palliative care prior to the last year of their life. And of these people, almost 80% living in low and middle income countries, yeah, especially in children, almost 100% who needs palliative care living in low and middle income countries, with almost half living in Africa. So I'm not sure. I think Dr. Alina mentioned to me earlier that Indonesia, according to the newest, the current data from World Bank, it's not is no longer considered to be a low and middle income. Is that right, Dr. Alina? I think we have raised our rank, yeah. But but of course, that talking about palliative care is not talking about rank, yeah. This is the fact, yeah. This is the obvious fact that we are facing, yeah, everywhere in the world, yeah. So furthermore, in 2014, it was estimated that only 14% of people needing palliative care actually receive it. Yeah, so the actual care, yeah, the actual care that people needing palliative care is very, very low. Yeah, although it's not too recent, the data is not too updated, but I don't think it will raise significantly up until now. Okay, okay. What is the global policy that we have up until now? So WHO Global Action Plan has already considered that the palliative care is a part of the comprehensive services for the non-communicable diseases. Yeah, in the action plan 2013 until 2020. Yeah, and even in the 2014, the World Health Assembly was conducted. Yeah, the first ever global resolution on palliative care to improve access to palliative care as a core component of health system, with an emphasis on primary health care and community home-based care. Yeah, I think we are aware that the palliative care is a very long treatment. Yeah, and also needed for a lot of resources, not only financial, yeah, but also economical, social, yeah. So that's why the perfect way, to put it, palliative care is on the primary health care and community home-based care. So one of the global policies about the access to opioid pain medicine. Yeah, it is included as one of the 25 indicators in the global monitoring framework for NCDs. Now, also we understand the dilemma, yeah, about the opioid pain management. Yeah, we are aware that the addictive effect of opioid, yeah, which occur, which emerge, yeah, in the long use, yeah, in the long utilization of any opioid pain medicine. So basically what the global policy referring to is that ensuring the accessibility of palliative care is not only a matter of ethical obligation, but also human rights. Yeah, human rights considered as an obligation under international human rights law. Yeah. So by this, yeah, we are understand that delivering palliative care is very, very essential. It is essential for maintaining the healthcare services, especially for the non-communicable diseases. So then, who can benefit from palliative care? Yeah. As we mentioned earlier, that it is discussing about the patient with life-limiting, threatening illness. Yeah, but not only for the patient, but also for the family. So in this case, that we have to assess the needs, yeah, of patient and their families. Yeah, and then we have to do multidimensional assessment, not only physical, but emotional, social, spiritual, and cultural needs. And also we have to consider the values and preferences of patient and families. Therefore, it is important to determine patients' values and priorities as a prerequisite to formulating the best plan of care. Yeah. And we have to also be reminded that family members and caregivers may also need emotional and social support. Yeah. And they will need bereavement support after the death of the patient. Yeah. As you understand, as you're aware from the previous presentation, that social support is among the component, the vital component of palliative care. Yeah, as well in the terminal care and life of life care. Yeah, so you have to be you have to put in mind, yeah, the importance of how that emotional and social support also may needed by the family and caregivers. Okay. And remember that needs will change. Yeah, if that we need to assess the needs of patients and their families and be mindful, but that the needs will change. Yeah, assessment of patients' need is therefore something that should be repeated regularly throughout the course of the disease. Yeah? So remember that palliative care affirms life and regards dying as a normal process. Yeah, it neither hastens nor postpones death. Yeah, by delivering palliative care, we are not trying to postpone that. Yeah, it is beyond our intention. It set out to preserve the best possible quality of life until death. That's why there coming a concept of good death, or what we are called husnul khotimah in Islamic terminology. Yeah, husnul khotimah means a good death. Yeah. It also means a more divine concept of that achieving husnul khotimah, we are going to go to um, Jannah. We are going to go to heaven. Yeah, this is based from the Islamic concept of Tawhid. Yes. So the philosophy and principle of palliative care, it should be done with patient-centered approach. Yeah, and also it should be done holistically, and we preserve dignity and respect, not only to the patient but also to the family. And we need to address the psychosocial and spiritual needs. Yeah, I think we already discussed earlier. Yeah, that the social, psychological, and spiritual problems are among the symptoms. Yeah, other than pain. Yeah, that should be considered as paramount. Yeah, in delivering the palliative care, and it is considered to be interdisciplinary. Yeah, encompassing the patient, the family, and the community in its whole. So in a sense, palliative care is to offer the most basic concept of care, that of providing for the needs of the patient wherever he or she is cared for, either at home or in the hospital or in the hospice. Yeah. Okay. So the support may also a spiritual care. Yeah. And caring for families and caregivers is important, as I mentioned earlier. Yeah. That's why bereavement support is a core component of palliative care. Yeah. And be mindful that family caregivers typically have unmet needs and problems too. Yeah. That's why they are prone to physical and psychological morbidity. With data shows that almost half of all caregivers, yeah, have potential depression and anxiety. Yeah, be 30% and 50%. So as you can see here, that it is a very, very what do you call it? A burden to take, yeah, for the family caregivers and also the anyone who involved in the caregiver for the patient. Yeah, because sometimes, yeah, I think one of my students in School of Nursing, yeah, I examined a thesis of my students in School of Nursing, He did a study on the caregiving for people with chronic illnesses, and there are examples of how even neighbor or social health care worker support is a sole support for a patient, yeah, because the patient doesn't have any close family to take care of, yeah. Instead, neighbor is done the caring for them, yeah. So I think we have to bear in mind that there are a lot of possibility who will affected by these unmet needs and problems for caregiving the uh, palliative care. Yeah. So and then we have also considered that family caregiver can make a significant and under-recognized economic contribution to healthcare. Yeah. I think many of you who works in a hospital-based or primary healthcare understand that many of patients will come with family. Yeah, they have to share. They have to support them with their own money, with their own resources, and then this is considered to be under-recognized economic contribution to healthcare, yeah, and a very significant. Now we are already talking about the interdisciplinary team, right, for palliative care, and this is the minimum of the team of palliative care. There's nurse, doctor, of course, nurse, psychologists or counselors, yeah, social workers, faith workers, and trained volunteers or community health workers. Yeah. So in practicality, in real life, we will face with the fact that many of these volunteers are not trained. Yeah, they're basically just, as I said earlier, neighbors. Yeah, or even the head of the village, yeah, who concerned for their neighbors, yeah. So this is the the minimum of the palliative care team. And the assessment we need to do the assessment and care planning, which composed of pain and symptom management, emotional and spiritual support, and advanced care planning. Yeah. So this is a mode of treatment, and most of the patient of palliative care suffering from pain, yeah. And then for the pain management, usually we are using the opioid, yeah. That is the current practice, and maybe some of you can go deeper into that, discuss more, yeah, into what is the practice here in utilizing opioid treatment, yeah. It goes for 80%, you know, almost 80% of patients with AIDS or cancer, and 67% of patients with cardiovascular disease or chronic obstructive pulmonary disease. Other than pain management, we are doing psychosocial support, spiritual care, family support, and legal support. And I'm going through a little deeper about relieving pain and other symptoms that other than pain, yeah, the most common symptoms occurring in the advanced stages of the most common life-limiting condition include anxiety, appetite loss, breathlessness, constipation, delirium, depression, diarrhea, fatigue, nausea, pain, and respiratory tract secretion. I think we understand that living with a diagnosis, yeah, it's like a label already put on your head. Yeah, maybe the doctor told you that your life is like 1 month less. Yeah, you already have that in mind, so anything can happen. Yeah, physically, especially psychologically. Yeah, so there's anxiety and depression is one of the most common symptoms. Yeah, and treatment should aim to maintain or improve the quality of life and optimize physical and also cognitive function. Yeah. And it requires treatment of the underlying cause of symptoms, if consistent with the goals of care, and also pharmacological and or non-pharmacological treatment of any symptoms, and attention to each patient's values and needs. Yeah. So we have to consider what is the preferences of the patient, yeah, according to their values and needs. For example, if someone who believes that he has to go through any halal or Sharia based treatment, yeah, so we have to consider that as important for them. Let's say like the using of halal medication, yeah. For those of you who is not familiar with the halal concept, halal means allowable, allowable in the terms of Islamic concept. To be practical, any food, yeah, or drinks or even medicine made from pig is considered not halal in Islam, yeah, not halal. But if you are discussing about medicine, there are a lot of discussing, there are a lot of debating. That for one hand, there's school of Islam that mention that it is allowable as long as considered to be emergency condition. Yeah, so we can still using the medicine made from or consisting contents of pig or derivatives from pigs. But on the other hand, there's also one school that they are not they are still not considering that as emergency. Yeah, emergency. Okay. So we have to stick on what is considered halal. Yeah. So that is one example of how we can take a look, yeah, and consider the patient's values and needs. Yeah. And also one aspect that is very crucial in palliative care is communication skill. Yeah, communication skill. It is well evident. It is evident when we are talking about breaking bad news. Yeah, and also the concept of honest and open communication and addressing cultural sensitivities. Yeah, we have to put that in mind. Yeah, especially in breaking bad news. Um, it it is regarded as an art. Yeah, where the physician has to strike a fine balance between the truth and the hope. Yeah. And how can we handle the emotional outcomes of the news on the recipient as well? There's one thing. There's another thing to be considered, that we have to handle the emotional outcomes. So in breaking bad news, there are implications. Is it not only ethical but also medical legal? Yeah. Whether we are going to handle withholding the information, yeah, or we are giving them autonomy, the right to know. Yeah. Whether we are going to withhold the information because we are thinking about what's going to happen with their mental health if the patient knows the true information. Yeah. And maybe it will jeopardize the therapeutic relationship. Yeah. When you start to say that you have cancer, your life is within months, and then they will deny it, and then they will not see you again because they don't trust you. Yeah. Although we understand that this condition happened because of the adverse reaction of the breaking bad news. Yeah. So this is one thing that we have to be considered. Yeah. As the implication of breaking bad news. And that's why the technique employed in breaking bad news can influence how the patient understand the information. And that's why we have to be very careful in addressing all the information needed. Yeah, and also it can influence also the satisfaction with the care, and over and above all, to what extent they can just adjust the psychologically to the bad news. Yeah, that's why we have to be very careful in trying to put the right technique in addressing the breaking bad news. Okay. Okay. So let's see here. All right. So that's all we are discussing about the concept, yeah, about palliative care, and then also the team who is working interdisciplinary, and also the concept of patient-centered care, and communication is one of the main concept of palliative care. And now, what is the impact values of palliative care? Yeah, according to the studies, there are a lot of studies that explain to you what is the benefit of palliative care. Yeah, one is to improve patient and family satisfaction with care, and also reduce 30-day readmission rates, reduce the ICU utilization, and can save 9 until 20% of cost for each inpatient stay through a mixture of shorter length of stay and reduced cost per day. Yeah, you can see from here. I will share with you the presentation so you can go further into the studies, yeah, to the articles, yeah. So this is what is the benefit, yeah. What is the impact values of palliative care? So it is very, very evidence-based and very significant in giving the benefit. So now that's a lot of types, a lot of practices in establishing palliative care services. Yeah. But you have to bear in mind that there is no single best starting point for all settings. Yeah. So we can setting up a palliative care service at the home care service. Yeah. Or integrating palliative home care into existing home care services. So basically, we're just letting the patient stay in their home, yeah, or in a community setting, yeah. The third one would be integrating palliative care services into a district or general hospital. The fourth one, establishing a palliative care service for children, including neonates, yeah. Children, children has another main issues in the palliative care because they need a very distinct care, yeah, for themselves. But this is not the scope of what we are going to try to talk about in this afternoon session. And it's also we can setting a standalone palliative care center or hospice, yeah, and taking an integrated approach in a district, yeah. So there are there are 6 of settings that we can establish in palliative care services. But I don't want to share with you all of them. Yeah, I want to share with you only what we can do in in a hospital setting, and maybe a little bit of hospice, yeah, or home care, sorry, home care. So, setting up a hospital-based palliative care service, yeah. Although we understand that in a hospital setting, usually the paradigm is curative, yeah, and rehabilitative, yeah. And it is perfectly matched how palliative care is delivered. But also we have to bear in mind that it will involve financial, of course, financial consideration, which I think any hospital management will put that into consideration. Practically speaking, that without insurance, yeah, without the cover of insurance, there's no way that the hospital can cover the palliative care services 100%. Yeah. So hospital-based palliative care also facilitates this discussion of patient values, diagnosis, prognosis, and agreement about the goals of care. And we start with that. Yeah. And in fact, generally, hospital-based service reduces patient length of stay in hospital and enables a smooth transition to care in the community. So basically, what the hospital is doing, yeah, when they are transitional care, yeah, before the palliative care is taking care to the community. And there's also evidence that it may reduce the use of non-beneficial or harmful treatment near the end of life. So a hospital-based palliative care service can involve one or more of the following options, either in a outpatient care clinic, yeah, as you can see down there, the picture, it is from Children's Hospital Palliative Care Clinic, yeah, or is it a palliative care consultation service for hospital inpatients, yeah, palliative care day care service, an inpatient palliative care unit, or a palliative care outreach or home care service. Yeah, I'm showing you at the right corner is a example of a home care, yeah, for palliative care. It's called Jatayu. It's organized under the management of Rumah Sakit Akademik UGM. This is academic hospital owned by UGM, Universitas Gajah Mada. Yeah, they're conducting home care services. Yeah, not only for the post-stroke, let's say post-stroke patient. Yeah. In fact, at the moment, I'm conducting a research collaboration with the RS UGM, yeah, involving this home care services. Yeah, I'm trying to monitoring their daily vital signs, yeah, which can lead to the general aspect of health of well-being, their well-being. So I'm monitoring their vital sign like blood pressure, heart rate, temperature, and also we are monitoring their sleep pattern, yeah, and fatigueness. Yeah. So this is example of home care service is there. All right. This is the part of the palliative care, and then maybe if you want to ask a question, I'll be, or maybe you can share your experience, your own experience, because I understand I believe that many of you have your own experience in palliative care, and you can share with us here, and I will be very glad to have that. Is there anyone want to share their experience or opinions about palliative care? All right, then if there's no one, we'll move on to spiritual care. Yeah. So this session we are talking about, we have talked about palliative care, and then we are going to talk about spiritual care. Yeah, spiritual care.
Pak Iman,
Yes,
there
yes,
is
please.
there is a question in the chat group from Lestari before we go to spiritual care. She said she wanted to ask for committee, do the PowerPoint will be shared to the person? Oh, okay, that is for the committee.
Yeah.
But yeah, I also think maybe after that I would also want to ask a personal question regarding palliative care as well. But
yeah, sure.
Regarding palliative
If you want to
spiritual
do it now, yeah, you can, Jesse.
maybe towards the end, because it I think it will also include spiritual care as well.
All right. Okay. Okay. Thank you. Yeah. As I mentioned earlier, that I will share the presentation here to the committee. Okay. And the committee can share with you all. All right. We already mentioned earlier about how spiritual care is core concept or core component, yeah, in palliative care. Yeah, so that's why I want to share with you here, separately about spiritual care. Yeah, so spiritual care is considered an essential aspect of whole person healthcare. Yeah, and spiritual health is the domain of the total health of person, which impact the total well-being of the person. Yeah, I think you already understand that the holistic concept of the health, yeah, the holistic concept of health that being addressed by the WHO consists not only the absence of physical but also social and emotional, psychological, yeah, and then other scientists will argue that also the spiritual aspect is composing as well the total health of a person. Yeah. So people who experience serious spiritual distress tend to have poorer of quality of life and greater depression and anxiety. That's why we believe that spiritual health is a very important as one of the domain of total health of a person. Okay. All right. Now, if we go through the spiritual care, yeah, WHO in 1998 mentioned that it is still regarded as they're not really looking toward. Yeah. So WHO say that until recently, the health profession have largely followed on the medical model, which seeks to treat patients by focusing on medicine and surgery and gives less importance to belief and faith. Yeah. So this reductionist or mechanistic view of patient as being only a material body is no longer satisfactory. So in the in the late 2000, yeah, almost in like 2 decades ago, people started to think that there is something wrong in that moment. Yeah. There's something wrong in the paradigm of how the healthcare professional seeks to treat patient by only focusing on medicine and surgery. Yeah, that's why the paradigm is changing at that moment. Yeah, that's why patient and physician have begun to realize the value of elements such as faith, hope, and compassion in the healing process. Yeah. Well, actually, if we are talking about traditional practice, I think most of us here understand that in Japanese culture, we already done it earlier, yeah, by using like dukun, yeah, but it is more likely to be it's a more traditional, yeah, and spiritual. The value of such spiritual elements in health and quality of life has led to research in this field in an attempt to move towards a more holistic view of health, yeah, including a non-material dimension, emphasizing the seamless connection between mind and body. Yeah, I think many recent studies has already underlined, it's already showing that, yeah, the holistic view of health. So, spiritual care is coming from the spirituality. What is spiritual means? Yeah, spirituality means comes from the Latin word spiritus, yeah, which means breath of air or air, yeah, and is not distinguished from religion, yeah. They are still talking it as one concept of religion until the emergence of secularism in this century, yeah, started from this century, starting from 2000s. Then they're starting to separate it between religion and spirituality. So a decline of belief in religion and religious leadership in the last several decades has put these themes in a more prominent view. Yeah, so because at that time the people started to disbelieve, started not to trusting religion and religious leadership, and then they tend to seek a more mindful, yeah, more than what we call spiritual, yeah. Okay. So then spirituality means all experiences and feelings. Yeah, sorry. Okay. All experiences and feelings associated with seeking purpose and meaning in life, or a subjective experience of the sacred. Yeah. So basically, what they're talking about is the definition of spirituality is that if someone is facing any experiences, yeah, and they have feelings, yeah, with this experience, they just came back to reflect what is this purpose, what is the meaning of this feeling of this experience to me, yeah, what meanings of it. So basically, it is acts as a guide to unify different aspects of personality and how to live life, yeah. So, or from the NHS 2009, it is described in a more practical way. Yeah, spirituality can be found in the integration of several deep connection with one's true and higher self, with oneself, with the society, especially with the poor, and the world of nature and other life forms. And for some, are connected with the transcendent. Yeah. So, if we are talking about spirituality, we're talking about a deep connection between us, to ourselves, to the society, and to the nature or the transcendence. Yeah. Talking about knowing, experiencing deeper meaning and connection behind apparently random events and processes such as illness and an awareness of human vulnerability. Okay. So I think if you are trying to remember, yeah, to look back at yourself, I think at one point of your life, or many points of your life, you can see that you are facing this spirituality points, yeah, of your life when you are talking with yourself, and then what happened to me, yeah, and then you're concerned about the poor, the deprived, and the underprivileged. It is a showcase of a spirituality. So, yeah. So many studies shows that there is a relationship, yeah, between religiosity or spirituality and well-being. Yeah. So one of the studies shows that spirituality and religion is supportive of health and well-being in old age. Or religious people are inclined to value different things compared to non-religious people. Highly religious people tend to see various challenges, interpersonal problems, or conflict in life through a religious perspective lens and deal with them in the same manner. Or spirituality is talking about relationship with God, yeah, and acting as coping mechanism, yeah, which then it leads to the well-being of the people. And also, if talking about spirituality and mental health, yeah, spirituality is important in the prognosis of psychiatric condition. In the spiritual perspective, a differentiation must be made between cure and healing. Yeah, if cure is talking about the removal of symptoms, but healing is more more general, yeah, beyond the removal of symptoms, yeah, healing of the whole person, yeah. Hence, in psychotherapy, the patient must be helped to accept the handicap and transform the handicap to a life of usefulness. Now, how about in Islam? Yeah. How about in Islam? If we are talking about spirituality in Islam, it goes to a journey in searching of the meaning of life. Yeah. That in fact, it is the primary purpose of a Muslim in attaining or servitude to Allah. Yeah, it is the main purpose of trust. I think many of you are Muslim, and we understand that in the Quran, Surah Al-Zariyat, verses 56, Allah mentioned that I created jinns and humans to serve me. Yeah. So the word Islam meaning to serve oneself under the rule of Allah. Yeah. And it is embodied in the declaration of Shahada, or declaration of faith. Basically, we are here, yeah, on earth, is to serve Allah. That's one main purpose of trust. Okay. So there, if you are talking more about spirituality, there's 4 domains. Yeah, according to the National Interfaith Coalition on Aging, the domain of personal, environmental, communal, and transcendental other. Yeah. Let's go through one of them one by one. Yeah, we're talking about personal domains. It's about interpersonal relationship with oneself in terms of meaning, purpose, and value of life. So it also describes about self-awareness as a transcendental power or aspect for the soul to seek identity and self-esteem. And I think it is very, very related to one of Islamic concept, yeah, which mentioned that if we understand oneself, and then we understand Allah, yeah. So this is very, very correlated, yeah. And how about the environmental domain? It goes beyond physically and biologically preserving the environment to achieving a sense of wonder and gratitude. Yeah. And for some people, a sense of oneness with nature is achieved. Yeah. If we are talking about, let's say, preservation of human life, yeah, or preservation of the nature, it is considered to be a domain of spirituality. Yeah, spirituality. So spirituality basically is not only talking about religion, a special religion, yeah, not only talking about God, yeah, but we are talking about any other relationship, you know. And how about the communal domain? Shown in the quality and depth of relations between people, attributed to morality, culture, and religion. Manifested in love, forgiveness, trust, hope, and trust in humanity. And we can see that for people who behave in a kind and generous manner, yeah, respecting each other, right, yeah, each other values, yeah, respecting each other's norms, yeah. It is also a showcase of spirituality, yeah, which I think every religion supported these values, yeah. And the last one is transcendental domain. It talks about the relationship of oneself to something beyond human limits, like the precedence, the forces of nature, the transcendental or God. Yeah, it encompasses trust, admiration, and servitude to the ultimate source of all the mysteries of nature. Basically, transcendental domain talks about something great, yeah, or God or Allah. Yeah. So those are 4 domains of spirituality. Yeah. And how about spiritual care? Basically, spiritual care will comes in any spiritual gap. Yeah. To improve the well-being of the person. So spiritual gap will cover the gap. Sorry, spiritual care will cover the gap in spirituality to improve the well-being. Yeah. Spiritual care is broadly understood as a type of care that addresses and seeks to meet existential and spiritual needs and challenges in connection with illness and crisis. Yeah. Okay, so basically, how they preserve well-being of the person. Yeah? So in practicality, we can see spiritual care as an expression of empathy, the sharing of hopes and fears, family stories, gesture or humor or sadness, and accepting recognition of culture or faith or belief. Yeah, this are indicative of the human spirit. Okay. Ladies and gentlemen, I want to share with you one of my stories. Yeah, when I did my PhD back then in UK, Dr. Sagiran, maybe you, I think all of you already knows Dr. Sagiran. I think he was the lecturer in yesterday session. Is that right, Jesse? Dr. Sagiran? And around 2000 and
Yes,
yes,
yes, yes,
all
yes,
right.
yes.
Around 2013, Dr. Sagiran was the head of the Center of Islamic Studies in UMY, the Faculty of Medicine. He asked me to do like a benchmarking of how spiritual care is done in a hospital base in Manchester. I was in Manchester doing my PhD. So I met them. I went there to the hospital. The hospital is close, very close to my house, yeah, where I was living. And then I met the chaplaincy, yeah, chaplaincy division. I met with the chaplaincy for Catholic, the Christian, and also for the Islamic chaplaincy, right? Bina Rohani Islam, as we usually call it in here in Indonesia. So I talk with them, and mostly I talk with the Bina Rohani Islam, the Islamic chaplain. His name, I still remember his name, and I think I still remember the face also. His name is Nu'man. Nu'man, we call it Brother Nu'man. So I talk with him, and then I asked, what is exactly the spiritual care that you conducted here in the hospital? The hospital is North Manchester General Hospital. Yeah, it's a general hospital. So basically, they're accepting anyone, yeah, with any religion affiliation. In fact, in that very hospital, there are a lot of Muslims, yeah, Muslim patient that's being treated. So that's why there's Muslim chaplaincy in there. So I asked him, what did you do to serve the patient? So he mentioned to me an example, a good example of what we are talking about, this spiritual care, this very, very slight, yeah, expression of empathy, sharing of hopes and fears. This one times, Brother one was asked, yeah, by a nurse, yeah, who was asked by a patient who needs a spiritual care. So there was a patient that needs a spiritual care and asking the nurse to summon the chaplain, right? And this patient is not Muslim. Yeah, he's a Christian. And then after the nurse contacted the chaplaincy, the only available chaplain is only Brother Nu'man, the Muslim chaplain. Yeah. And then the nurse asked the patient whether he wants to carry on with the session of spiritual care. And the patient said yes, yes, he wanted to do the spiritual care. Although the chaplain is from Muslim. So they met. Yeah. Brother Numan came to see the patient and give the spiritual care. And I was wondering at that time, what's going to be the session was. Yeah. And he said exactly what is this slide telling you. Yeah. He's just there listening to the patient, yeah, listening to the ideas, yeah, to the hopes and fears, yeah, to what happened with his family, and sharing humor and sadness. Yeah, that's what exactly Brother One did to the patient. What exactly happening in that session of spiritual care? So basically, just give them empathy. Yeah, He was just an active listener to the patient and give them empathy, right? Sharing humor, sadness, and accepting recognition, right? So that is basically, and I think it is very, very interesting. I understand that we here in Indonesia, mainly we are coming from Muslim, yeah. Almost like 88% of us is a Muslim. So basically, well, who came to the Pekau Gamping, let's say, mainly Muslim, but at the time when we are facing with different religion, we have to be prepared, yeah, for any needs in spirituality. I hope you understand what I'm trying to say to you. Okay, so the need to give and receive love, the need to be understood, the need to be valued as a human being, the need for forgiveness, hope and trust, yeah. The need to express feeling honestly. Okay. The need to express faith or belief, the need to find meaning and purpose in life. Yeah. This is a similar definition of spiritual kind. So I want to show you an example. Yeah, an example of how being not a spiritual. Yeah, I took this from a study. Yeah, it's talking about a psychiatrist. Yeah, a psychiatrist when he's facing a patient, and this psychiatrist only seeing the patient as an illness. Yeah, an illness. Yeah. Instead, what happened to the patient what happened to the patient was that he's not being respected as human being. Yeah. You can read it by yourself. Yeah. But I want to share with you that this is what happened on the other side of the healthcare. Yeah. If you are a doctor, if you are a nurse, and you have to think also from the side of the patient. Yeah. How they want to be treated. Yeah. They didn't want to be treated as the cases, as illness, but they want to be treated as human, yeah, who have values, who have norms, who have feelings, yeah, and it is very much correlated to what we are talking about, spiritual. Yeah. So spiritual care and nursing care, we are talking about systematic approach, yeah. Um, initially with the assessment of spiritual needs, yeah. And then also we have to create a relationship of trust and respect. And we have to look also for the environment, yeah, around the client, the patient, yeah, about the feelings also, yeah, but bodily function, abilities, and other data. Yeah. This is like a spiritual comprehensive treatment, yeah, from Kunik. Yeah, we have to start with psychiatric history, spiritual orientation, and religious practices. Yeah. Respect and support patients' religious belief to cope better or do not adversely affect their mental health. Partnership with the religious worker, yeah. Praying with the patient, yeah, if needed, yeah. If spirituality is related to mental health, and if religious beliefs and experiences are important in the life of the psychiatric patient, should include religious concept in psychotherapy. Yeah, I understand that a lot of psychiatric here in Jogja and Pekau, mainly in Pekau Gamping, yeah, that already integrate, yeah, many religious concept in psychotherapy, yeah, because I get this information from not only patients, yeah, I'm practicing as a GP, so sometimes sometimes I get several cases of psychiatric, yeah, and I talk with them, and then they affirm, yeah, to me that there's a lot of practices in how the psychiatrist already integrate religious concept in psychotherapy, okay? Like education on praying, yeah, like mentioning sabar and zikir as the source of coping, yeah, and so on and so forth. So now I want to show you example of spiritual assessment, yeah, as I mentioned earlier, as initial step of spiritual care. This is from the Hope, yeah. Hope questions as a practical tool for spiritual assessment. Yeah. Hope stands for, Hope itself stands for H is hope, O is organized religion, P for personal spirituality and practices, E is effects on medical care and end-of-life issues. Oh yeah, I think our brothers in Turkey is facing the time for Jumat, yeah. Yep. Please, you can leave the session and doing the Jumat prayer. It's absolutely yeah, all right with me, yeah. So going back to the hope question for spiritual assessment, yeah. This is the sample question of sources of hope. What are the sources of hope, strength, comfort, and peace? Yeah. What do you hold on to during? What do you hold on to during difficult times? Yeah. And how about the organized religion? Are you part of religious or spiritual community? Does it help you? And how? Yeah. Personal spirituality practices. Do you have personal spiritual beliefs? What aspect of your spirituality or spiritual practices do you find most helpful? Yeah. And for the effects on medical care, does your current situation affect your ability to do the things that usually help you spiritually? And as a doctor, is there anything that I can do to help you access the resources that usually help you, and so on and so forth? So these questions is about spiritual assessment that can guide you to evaluate the condition of spiritual status of your patient. Yeah. And then this is another example of spiritual assessment that is developed by Dr. Sagiran. Yeah, I already mentioned it to you earlier, Dr. Sagiran. So his study, yeah, Dr. Sagiran just did a doctoral study in UMY in Islamic psychological education, if I'm not mistaken. So as the result, yeah, as a product of his study, he developed an early assessment of healthcare, of holistic healthcare. Yeah. Basically, it assesses two main components of holistic healthcare. The acceptance, yeah, yeah. First is the acceptance, and two is the obedience, yeah. Acceptance leading to their condition, yeah. The acceptance to the current condition of the patient. It's leading to physical condition, yeah. The illness, acceptance to the illness. And the obedience is referring to the obedience of patient to the worshiping, to the ritual practice of religion. Yeah. Basically, we are talking about acceptance of the illness and the obedience to the religion. Yeah. So there are 4 questions from the acceptance, and there are 3 questions from the obedience. Yeah. And we are going through one by one. Yeah. So the acceptance composing of what do you think at the moment is your condition? Yeah. What is the concern at the moment of your condition? Yeah. Is there are you being ill? Is the concern is that you being ill, or that you haven't been visited by the family, or there are problems at home, or there are financial problems? What is your current concern at the moment? Yeah. And then the second one, how do you think about the current state of your disease? Whether it is considered as a natural condition or as an unfairness from Allah, unfairness of Allah, yeah, unfairness of God, as a fate or destiny, or your illness is a trial, warning, and blessing. Yeah. And what is your perception of the illness? Is it not acceptable, angry, sad, or accepting? And the last one would be, what do you think about your future? Yeah. Considering that what you are facing at the moment. Yeah. Considering that you are ill at the moment. Are you pessimist? Are you doesn't have anything to think? Are you pessimist but still hesitant about the illness? Or are you pessimist because of Allah? Yeah. So we are going to score this. Yeah. And for any A alternate options, you will score 1 and D is 4. So 1, 2, 3, 4. Yeah. A, B, C, D is 1, 2, 3, and 4. Yeah. The same for all 4 questions. And how about the obedience? Obedience talking about the obedience of following your religions. Yeah. The first one, how is your worshiping whether you are sick or health? So never done salat either in health or sick, or sometimes you did it. You always do salat at time of health, but not when sick, or you'll always do that whether health and sick. Yeah. For those of you who are not Muslim, if we are talking about salat, yeah, salat is the main obligation. Yeah. Salat is the main obligation of worshiping in Islam. So everyone here who are already considered to be adult, yeah, we have to do salat, yeah, in any condition, because Islam oblige us to do salat also in the illness condition, in any way that sufficient you, in any way that afford, what they call it, in any way that convenient to you. Yeah, in any way that convenient to you. It means that usually if you are healthy, we are doing salat by standing up, right? But if you cannot standing, if you cannot standing up, you can do by sitting down or even lying down. Okay, so basically, salat is the one obligation that we have to do. Interesting enough, I want to share with you also information from my students. Yeah, from my students who's done medical round in the hospital, even in PKU Gamping. Some of the patients believe that they cannot they are allowed not to do salat if they are sick. Okay, in the condition of sickness or illness, they can leave the salat away. Yeah, which is not allowable actually. Yeah, we have to do salat. Right. So that is the explanation of the salat. Right. The second one, what do you think can help achieving your recovery? Yeah. What do you think any factor that can help you achieving your recovery? A is no idea, B is family support, C doctor, and D support and pray from all, right? And the last one, what does religion mean for you? None, unfair, binding and regulating, or protecting passionately. So after that, we're going to score. Yeah, we're going to score. And from this early assessment analysis, we can have like 4 matrix. We can have a matrix, yeah, of 4 dimension. Yeah, it is acceptance or not acceptance. It is obedience or not obedience. Yeah, with this score like this. Okay, and then let's see. Right. So if this is how the scoring is analyzed and interpreted. Yeah. So if someone is not obedient to religion and they are not accepting their condition, they get into the sorrow status, yeah, sorrow dimension. And there are 4 dimensions, there are 4 status, yeah. It is sorrow, growth, revive, or nirvana. Okay. Sorrow is referring to that the patient is not obedience and is not accepting the condition. And growth is referring to the patient is accepting their condition, but they're not obedient. They're not doing the ritual. They're not obedient. And then oppositely, if the revive, it's referring to that the patient obedience to do the worshiping, yeah, the ritual, but they're not still accepting the condition. And the last one will be the nirvana, in the status whereas the patient accepting their condition and also they are still obedient in doing the ritual. So it has 4 status condition referring to SGRN, yeah, SGRN, Sagira, yeah. It's referring to the developer of this concept, yeah, Dr. Sagira. So sorrow means the patient experience problem in aspect of psychological and spiritual oppression, and so on and so forth. Okay. So now we move on to the treatment. Yeah, treatment analysis. Yeah, there are 6 treatment alternatives. The first one is relaxation. It's referring to the psychological relaxation, motivation enhancement, self-awareness development, worship guidance, prayer motivational, and increasing capacity in terms of Sharia, yeah, or fiqh, or any Islamic values and norms, yeah. So for any patient with the sorrow dimension, they need relaxation, yeah. They also need self-awareness development. They need worship guidance. They need increasing capacity, yeah. For any growth, any patient in the growth dimension, they'll need worship guidance, prayer motivational, and increasing capacity. For revive, they need relaxation and self-awareness development. And for the nirvana, which actually they're doing all right, yeah, they only need motivation enhancement to keep their going in the straight path, yeah. So that was the example of the assessment of spiritual care. Now, how about the spiritual treatment? Yeah, this is we are talking about the current and conventional treatment for spiritual. They are spirituality augmented cognitive behavior therapy. Yeah, this is a treatment technique incorporating spiritual values to cognitive behavior therapy, which we already aware of them, which was developed and promoted at the University of Sydney. 4 key areas are emphasized: acceptance, hope, achieving meaning and purpose, and forgiveness. Yeah. The main techniques are empathic listening, facilitation of emotional expression, and problem solving. The use of meditation, prayers, and rituals together with monitoring effects of beliefs and rituals on symptoms form the behavioral components of the treatment. So I think it represents a very, very interesting mode of treatment, yeah, which augmented spirituality into a conventional cognitive behavior therapy. Yeah. So how about spiritual care in Islam? Well, I already mentioned earlier with you some of the example, yeah. Mainly, if we are going through all, maybe, I don't know, this is based on my perception and my experience, yeah. Maybe you who works or works in, or who you are working in a hospital can confirm, or maybe you contradict. There was no, until at the moment, there's no spiritual care in terms of that spiritual concept, yeah, in Islamic hospital, yeah. In Indonesia. but please correct me if I'm wrong. Yeah, but spiritual care, as what I mentioned earlier, an example from the UK practice. I don't think it is here in Indonesia. But mainly, what we are talking about spiritual care, usually linkage with religious care. Religious care. What I meant with religious care is that it's related to question. Yeah. How can we do salat when we are bedridden? Yeah. If we are hospitalized, yeah, how can we do salat then? How can we do ablution, taharah? Yeah. So usually associated with that kind of condition. If I want to do, if I had a colostomy pouch with me, or if I had a catheter, yeah, with me, how can I do salat? I feel very, very dirty. I feel unhealthy. Yeah. How can I do salat? So usually those kind of things that usually emerge as a consideration in the hospital around Muslim, yeah, all right, Muslim practice, yeah. Or maybe doing life-saving practice, and then we also giving talqin. Yeah, how can we establish a life-saving action without leaving Islamic concept or norms? Yeah. We believe that in that kind of condition where someone is facing near death condition, we have to be there and doing praying for him, for the patient. Reciting Quran with them. So how that can be possible in this kind of condition? That is one consideration to be put in Islamic hospital setting base. Yeah. So who's responsible for doing spiritual care or religious care in an Islamic setting? Yeah. Doctor, nurse, chaplain. Yeah. Chaplain will not be there 24 hours a day. Yeah. Whereas the needs for spiritual care is almost 24/7. So is it doctor should be responsible or nurse? Yeah. Especially nurse, because nurse is there 24 hours a day compared to doctor. Yeah. So I'm sharing with you an example, also a workshop that I attended to in 2015. I attended a spiritual care workshop. The sources is from America. Yeah, he was a Muslim chaplaincy. Yeah, he was a Muslim chaplain. So he's talking about spiritual care in America, and he said to us, the participant, that you, doctor and nurses, are responsible also to give the spiritual care. Yeah, that's why here in UMYA, we are implementing. I think Dr. Kusbarianto already gave the presentation about. Oh, maybe after all, later on. Yeah, we here in UMYA, we are doing a program of Padepokan. Yeah, who intended to give additional competence for the doctors to understand the Islamic perspective, the needs of patient, and the Islamic perspective. And the practicality is like explaining to the patient how to do salat. This is very, very practical example. How to do salat while you are being sick, while you are hospitalized. Because as I said earlier, there are a lot of patients who doesn't understand. Yeah, that they are still obliged to do so. Yeah, they can have a competence how to competency how to like give prayer with them, prayer with the patient. And one of the testimony from my students is that when the patient were given, yeah, the example from the student, they felt really happy. Yeah, when my students explained to them how to do sholat, how to pray with them together, they feel very happy. So I think it is example, also maybe small example of how this practice, yeah, should be carried out, yeah, more prominently in, especially in Indonesia, yeah, in the hospital setting, yeah, because we know that there's a need for the patient, yeah, to be treated that way. Okay, they need it. Okay, all right. So these are so this is the end of my presentation. This is only a summary of our session this afternoon. That we understand that palliative care is a part of the integrative care for the life-limiting illness, chronic illness, yeah, which aim to enhance the quality of life and promote dignity. And it works not only to the patient, but also the family, yeah. And very crucial to identify the needs and tailor their treatment, yeah. And we also consider the spiritual care as a part of individual need, which we can deliver it based on trust and respect.